also welcome now Dr. Abdullah Abdulgader, of course. I'm board member, Heart Math Institute, also president of International Conference for Advanced Cardiac Sciences, Kings of Organs.
Yes.
Doctor, first of all, welcome to the show.
Thank you very much.
It's a real pleasure to have with us here
Thank
today.
you very much. Nice to be with you.
Thank you. Doctor, first of all, before I go ahead and very interesting topic, by the way, I think it's going to also have people wondering and asking many questions. The heartbeats and the message that, I like the part where you said that the heartbeat, I can just send messages, for example. And so tell us more about it and more about the research that you're currently doing.
Thank you very much for inviting me to be here with you today, this morning. Actually, speaking about the heart, if we go back to the history and discuss the role of the heart in human civilizations, you will find something interesting. Almost all civilizations have agreed that the heart is a very holy organ and very important before the explosion, the technical explosion which happened in the 20th century. And maybe the 20th century has a lot of materialism thinking. This is why the role of the heart in the 20th century was limited to a lot of extensive research related to the micro issues of the heart, and mainly related to the heart as a pumping organ. Actually, the human heart, we agree that it is very sophisticated and very efficient pumping organ. But the new message which is coming at the beginning of the 21st century is that we are trying to convey another message to the whole scientific world, to the scientific communities, that the heart is much more than being merely a pump. It's much more than that. The holy rule of the heart within the body actually qualified to be called king of organs. We know much about the heart now, which is actually heralding the onset of a new science which is going to be a revolution in the whole practice. Yeah, if you have specific questions.
King of the organs.
Yes, true.
And that's, for most viewers, I suppose we think of the brain as the king of organs. Can you explain to us why do you refer to it as that?
Actually,
obviously you're a cardiologist.
This is a question which needs a very extensive answer. It may need conferences, but simply saying, just to say it in a very simple language so that our audience will understand what we are discussing. You know, the human heart is the first organ to function, and it is the last organ to stop functioning. So, you know, when we were just very tiny embryos, small amount of cells, our hearts were beating at the third week of life in utero, and nobody will be announced death until the heart is dead. We know that the 20th century gives a major role to the human brain, and it is true that the human brain is a very critical organ, but if we call the heart as king of organs, we call the brain the crown prince. But now the new message and the new medicine we are discussing is that the heart has a major role, which is, in addition to its major role as sophisticated pump, it has a lot of things to be discussed related to its energetic role. There is a new science which is just emerging called neurocardiology. If we are going back to extensive researches which has been done in the last few years about neurocardiology, we will find that messages between the heart and the other organs are very extensive, and mainly to the brain. The amount of messages between the heart and the brain are huge, but if we subdivide it to brain to heart to brain and brain to heart, the messages which is signaled from the heart to the brain are much more than signals from the brain to the heart.
Now,
and this is true.
Now, Doctor, talking of which, you've been holding conferences over the last 3 years, and I believe this 2006.
Actually, from yes, more than
2006.
3 years.
Okay.
Yeah.
And this year will be the 4th year, or?
It will be the 4th chapter. Yeah.
Okay.
Yeah.
And these are international conferences, and there has been so many changes, intellectual and philosophical changes in cardiac diseases and surgery over the past years. And there's been mysterious advanced sciences, shall we say, in cardiac diseases as we know it. Can you explain to us what the science has evolved to now?
Yeah, thank you very much for this question. To make it simple, what has been done in the last, let's say, 80 years in the era of cardiac sciences, the heart was dealt with as an organ, and a little has been discussed about the role of communication of the organ, this organ to other organs and to the surroundings. So if we are allowed to say it was a micro, and we were going under microscope and electron microscope to discuss what is inside the cell. But I will say it loudly, we neglected the external rule. So the macros, if we are allowed to say the macros outside the heart, has been neglected. The role of the human heart, now we can measure energetic organ, which is extending 6 to 12 feet, surrounding the human heart, which is produced with each heartbeat. And this energetic field has been neglected. Now we have evidence that something called heart rate variability, this is beat to beat relationship, it is a science by its own, and we know that heart rate variability and the beat-to-beat relationship carries major informations which is transmitted through the environment. There is something called very low frequency bands and the heart rate variability bands, which is more than one band actually, which is exactly compatible to what we have in the ionosphere around the planet. And now we are discussing the role of the human heart and human heart's communications through the ionosphere. Now we have the capability of to measure the Schumann resonance, which has frequencies compatible with the heart frequencies. So it is like a radio. When you want to get the channel, you just go make the signal the same length, and you will get the channel. So I think it's a new science, and we are heralding the onset of this science.
Very interesting, doctor. These points, I think, not just a lot interesting, but I think very also attractive, and it will also make the human beings in general think about many coincidences that happen sometimes. For example, you gave me a great example before the show. That you said that sometimes, for example, when you go into a place or into a store or anything,
yes,
that you feel I'm close to this person, but to this person you feel negatively. This is also physics.
This is physics.
As you mentioned.
This is physics. For those who attended our conferences, details of this has been shown. You know, I would like, this is actually a message to the scientific community in Saudi Arabia. You know, we know we are Muslims, and Saudi Arabia is the leader of Muslim countries, and we are proud to say, we will not hide it, that the heart has been mentioned 126 times in the Holy Quran, and it has been referred all the time as emotional organ, as decision-making organ, and none of them has been mentioned as a pump. And I think, you know, I'm not a religious scholar, but I'm speaking about my part related to basic sciences. We are speaking about waves, where you can see changes, actual changes. So when you come close to somebody, we can measure EEG of the brain, you know, the electricity of the brain. We can detect the heart signals of the mother and the EEG of the brain. No, and this is a fact.
Doctor,
this is a fact. This is something that we can see, and it has been documented already.
Doctor,
yeah.
Sorry to interrupt you, but this is really quite incredible and amazingly interesting and new for me to hear this, that it's an emotional organ, you say, and that a mother and a baby is connected. And does this also mean, because, you know, for so many years we listen to Hollywood movies,
yes,
and you hear of people dying of a broken heart. Could this be true?
This is true.
It's true.
I'm not speaking about broken heart syndrome. It is all cardiologists in the whole world know broken heart syndrome. This is a single entity which is discussed clearly. Now we discuss more than this. Now the broken heart syndrome, the underlying pathology and problems were not clear until we discussed the issue of the heart being an emotional organ. Just to give the audience idea about how much this science is big and how much it is effective. We have two major organs in the human body producing energy. This is the human heart and the human brain. And we can detect this energy. Just if you compare the heart energy, energetic field to the brain energetic field. Can you guess what is the ratio? 1 to 2, 1 to 3, 1 to 5? It's actually 5,000 to 1 in favor of the heart. 5,000 to 1. And the signals which we can measure on paper and on screens, the heart is more than the brain by 60 times, 60. So we are speaking about something which has been neglected over decades, and if we go to our history books and our philosophy, we will find our ancestors detected the truth before us maybe. But it's the time to elaborate more on this science.
Doctor, many things comes into my mind now also. When you mentioned,
Yes,
when she mentioned broken hearts, I used to actually laugh or make it a joke when they say, love could kill you, buddy,
Yes.
like, for example, or love could have effect on the heart itself. But also, going that strong as a scientific researcher also into the heart itself. Solutions also for the heart problems that the persons face. For example, the issues in general that the person could face, diseases of cancer, of any other. Could these research or by physics, for example,
Yes.
I could help, for example, treat some other part of, or as you call it, orgasm is, or was it? It's origin of the body by just the way that you mentioned it.
Thank you very
I
much.
think it's very important.
You know, Walid, what you are mentioning now is part of our neuroscience, which we call intuition. Intuition, you can read the ideas which is coming in the next few seconds or in the next few hours. And we think this is a hard science now. We think it's true hard science. What Walid is asking about is, yes, now we came to actually practical implications of this science. Now, at this moment, in the last conference actually, we introduced the idea of playing with the, or self-regulating the heartbeats by self-practice to reduce human heart blood pressure, arterial blood pressure. And actually we created 3 groups of different stages of hypertension with medications and without medications. And we went to very sophisticated numbers, and everything was blind. And at the end, now, thanks God, our research is published in one of the prestigious American journals, which is coming actually in May issue. It's already done. And I think this will open a new era of science. Playing with the self-regulating your heart can do a lot of things. You know, you mentioned something about love.
Yes.
I think it's not a shame to mention love, because love is not a shame. Love connects me to my family, to my children, to my parents, to my country.
Well, it's the
It's
greatest
love.
human
It's all love.
emotion, yes.
Exactly.
So love is the top of the pyramid of emotional feelings. So with love, if you are in a love stage and go to your beat-to-beat organization, you will find it very well organized. And if you are frustrated, if I say something which will go under your skin and give you pain at the same time immediately, we can see this also in your heart waves. It's like bizarre, like a baby who's playing on paper. It's very clear. The new stage of very regular heart, we don't mean it's regular one-to-one, but the general shape, we call it the heart rate variability. When it comes to the level that we like, we call it coherence. Coherence is a new terminology that we are introducing through our conferences related to the heart. And when we reach to the stage of coherence, now actually one of the scientists of the conference introduced a new device which can tell you are you in coherence or not by lamp color. It will go red, blue and green. So when you train yourself to go to the green on daily basis, and actually we in Saudi Arabia, we advise to use tasbih, dhikr, and reading phrases of the Quran.
Exactly.
And we were successful to reduce blood pressure immediately for our patients. And this is actually something which is heralding a new history also.
Exactly, Dr. Abdullah. Dr. Abdullah, first of all, I was really interested and amazed and very proud, of course, to have Saudi doctor like yourself representing us also overseas, I think, personally, and also from the media sector. Dr. Abdulgader. Unfortunately, we have so much time to do actually, but we definitely these two topics we need just not just episode, maybe a whole show, just to discuss this with you, which is interesting. Thank you so much, Doctor.
Thank you very much. Thank you for inviting me.
It's a shame.
It was a pleasure being
we
with
would
you.
love to have talked more about this and,
Yeah, it's okay.
and other issues.
Yeah. Good.
Exactly.
Thank you very much.
Definitely.
So we are done.
We are done. Dear viewers, we're
Unfortunately.
going now and take, of course, a small report after that very interesting segment with Dr. Abdullah Abdulgader. So stay tuned.
Role of industry in leading the decision of what to do and how to perform left its negative impact on the medical practice as a whole. Congenital heart disease refers to as a problem with the heart structure and the function due to abnormal heart development before birth. Congenital Heart Disease Project in Saudi Arabia is a case control project of congenital heart defects in Saudi live-born infants. 2005-2010 was finally completed. Hospitals, primary healthcare centers, pediatric cardiology centers in KSA concerned with congenital heart diseases participated in the study, constituting a unique national sample. The main objective of the project was to shed light on probable environmental and genetic risk factors implicated in the etiology of congenital heart disease in Saudi population. Cases were defined as infants born alive in 1988-2008 to parents who were residents of the study area. Disease status defined as congenital heart disease, present at birth coded 1, else it is absent for the coded 0. Congenital heart diseases, diagnosis confirmed before 1 year of age by pediatric cardiologists, according to hierarchical classification system. Questionnaires were expanded to include a detailed inquiry about exposures to various environmental and genetic factors. 7,327 questionnaires from all over KSA were collected. Parents are interviewed about a wide range of genetic, physiological, medical, and environmental factors that occurred during and before pregnancy, assessing exposures at home, job, and other sites. Data sheets were designed to filter and encode with information from the questionnaires and qualitatively controlled. Original data was strictly maintained and adhered to standardization protocol. The database records and variables amount to 7,327 multiplied by 412 information matrix maintained within a relational database system established on Oracle SQL Server. With such huge scientific efforts, the dream of prevention of the mastery of congenital heart diseases in the kingdom and worldwide should be a reality. In the last few years, robotic technology witnessed exponential major developments, qualifying it to be a delicate part of the most critical medical procedures. The very fine branch of medicine dealing with rhythm disorders and intracardiac ablations, called electrophysiology, is just recognized in few Western countries to be a robotic procedure. Kingdom of Saudi Arabia, as a part of the international chain practicing the state-of-art medical procedures, is celebrating the onset of robotic electrophysiology service in the country. Prince Sultan Cardiac Center Al Ahsa was the venue of the event. More than 15 complex procedures were accomplished successfully for Saudi patients by Saudi experts. The major technical and health advantages of the robotic procedures is now for the benefit of the Saudi population.
Welcome back, of course, the viewers from that very interesting medical segment, actually, that we just, of course, spoke about many of the importance, of course, of the heart disease, and how, of course, to treat these sort of cases. But now we move on from the medical side and to the more easier side, more nice side, youth side, generation. Of course, the new generation also